Hey guys, welcome to Fun Learning, and this video is going to be about the knee joint. Actually, in the previous video, we have completed till the cruciate ligament, I guess, and this video is going to be the continuation of that video. That is the remaining thing we are going to discuss over here. That is menisci, transverse ligament, meniscofemoral ligament, coronary ligament. Then we are going to talk about the synovial membrane, the bursa, the relations, and we are going to talk about the nerve supply and blood supply. And the movement will be a separate video. I'll upload within tomorrow or day after tomorrow. I'll upload the movement, which is quite important. Okay, so now with no more delay, let us go with menisci. So what is menisci? Okay, now first I'll say what is menisci. The line that is given in the book. Later I'll explain what is the meaning of that line. Okay, so menisci. These are two concentric plate of fibrocartilage present on the articular surface of tibia. The first point is these are two concentric plate of fibrocartilage present on the articular surface of tibia. As you know, two crescent. What is two? They mentioned two. So one is medial meniscus and one is lateral meniscus. So they are two. Another, what they say, it is crescent shaped fibrocartilage plate. So this is crescent shape. Crescent is nothing but half moon shaped. So crescent shaped. Okay. And these present on the articular surface of tibia, that is nothing but on the medial condyle and the lateral condyle. The one which is present on the medial condyle is known as medial meniscus, and the one which is present on the lateral condyle is known as lateral meniscus. I hope you understand. And this meniscus has two horn, two surfaces and two border. Two horn. Here, this is posterior horn. The one which is present here is posterior horn. And the one which I shaded with pencil, this is anterior horn. The same, it is posterior horn, it is anterior horn. So we have two horn, posterior horn and anterior horn, and we have two surfaces, superior surface which is above, which is concave, and that will articulate with the condyles of femur. And the inferior surface, it is flat and that rests on the articular surface of tibia. Okay, so then we have two borders, the one which is present outer side, this C, we have two C there. One C which is present outside is peripheral border and one C which is present inside is inner border. Okay, so first you should know meniscus. These are two fibrocartilage plate that are present on the articular surface of tibia. We have two menisci. The one which is present on the medial condyle is known as medial menisci, and the one which is present on the lateral condyle is known as lateral menisci. And we have two horn, anterior horn and posterior horn. We have two surfaces, superior surface and inferior surface, and we have two border, the peripheral border, the inner border. So far, I guess you understand. We will separate it. We will read it separately. First, we will deal with medial meniscus. It is C-shaped, right? It is C-shaped. And this is posterior horn, as I mentioned here. This is anterior horn, as I mentioned there. So this anterior horn is situated present in the anterior intercondylar area. Nothing but the area which is present between the two condyle is known as intercondylar area. So the anterior horn is present on the anterior intercondylar area and anterior to the anterior cruciate ligament. So anterior cruciate ligament ku munnadi front la irukku. So anterior cruciate ligament. The posterior horn is present in the posterior intercondylar area and it is situated anterior to the posterior cruciate ligament. So if you remember one, you can write the exact opposite to the other. Anterior horn and posterior. I explained it. And here one thing you should remember is this periphery. Periphery is nothing but outside. This is tightly attached with that of the capsule. Capsule is, you know about it. Like capsule is nothing but that surrounds the joint. It is tightly adherent with that of the capsule. So it is less mobile. Okay, just I will explain what is medial meniscus. It is C-shaped. And second, I said about the anterior horn. It is present in the anterior intercondylar area and anterior to the anterior cruciate ligament. And I talk about the posterior horn, exactly opposite to it. It is present in the posterior intercondylar area and anterior to posterior cruciate ligament. Right? Then I said that this peripheral margin is tightly adherent with the fibrous capsule, so it is less mobile. Now we'll go with the lateral meniscus. Okay, so in order to know about the lateral meniscus, this is circular in shape. Yes, now let us discuss about the lateral meniscus. So in order to know about the lateral meniscus, it is circular in shape. Right, here these two horns are very close to each other when compared to the medial meniscus, in which they are far apart. Okay, now let us talk about the horn. So anterior horn, you know about it. Anterior horn is present in the anterior intercondylar area, as I mentioned about the medial meniscus previously. So the anterior horn is present in the anterior intercondylar area and posterior to the anterior cruciate ligament. So this is anterior and this is posterior. It is situated posterior to the anterior cruciate ligament. Then we'll talk about the posterior horn. Posterior horn is situated in the posterior intercondylar area and anterior to the medial meniscal attachment. Okay, so anterior to the medial meniscus or attachment ku munnadi it is present, and idu posterior anterior cruciate ligament ku pinnadi it is present. That's all. Okay, so disc munnadi and disc pinnadi. Okay, so now let us talk about the peripheral margin. As I mentioned about the medial meniscus, the lateral meniscus or a peripheral margin is not attached to the fibrous capsule. Because of that is movable. Okay, so this peripheral margin of the lateral meniscus is not attached to the fibrous capsule. So the lateral meniscus is movable. Okay, I guess there's no doubt. So what is the function of menisci, which is very important over here? So one, it deepens the articular surface of tibia. Let us write over here. Oh, I'm sorry. It's not writing. It has four functions. One, it deepens the articular surface of tibia. Similar to glenoid labrum, as we study, glenoid labrum is attached to the margin of glenoid cavity, and that deepens the concavity of the glenoid fossa. The exact is here. It deepens the articular surface of tibia as it is attached to the tibia. Second, it rubricates the joint cavity. Okay, it moistens the joint cavity. Third, it acts as a shock absorber. As it present between two bones, it acts as a shock absorber, similar to the one which is present between two vertebral column, right, intervertebral disc. Same like it acts as a shock absorber. And therefore, the most important, it divides the joint cavity into two. It divides the joint cavity into meniscofemoral and meniscotibial for independent movements to take place. Okay, now it deepens the articular surface of tibia. It rubricates the joint cavity. It acts as a shock absorber. It divides the joint cavity into two. I guess so far there's no doubt. Next, we should talk about the three more important ligament. As I forgot to mention in the previous video, one is transverse ligament. You can easily say, what does transverse ligament do? This connects the anterior horn of both medial meniscus and lateral meniscus. That's all. No need to worry about it. Just draw a diagram and write about the menisci as I mentioned previously. So this transverse ligament will connect the anterior horn of both the menisci. So as anterior horn, here one ligament is coming in attaching over here. Okay. So what about the posterior horn? Here we have another ligament that is known as meniscofemoral ligament, as we mentioned over here. So with the name you can able to understand menisco. This ligament connects the meniscus and the femur. So this meniscus, what does it do? It connects the posterior horn of the lateral meniscus to the medial condyle of femur. Just you write this, that's enough. So meniscofemoral ligament, this will connect the posterior horn of the lateral meniscus to the medial condyle of femur. I guess there's no far doubt in this. Okay. Next, there's one more ligament that is known as coronary ligament. So this coronary ligament is nothing but a part of the fibrous capsule that provide attachment to the peripheral margin of the medial and lateral meniscus. Coronary ligament will be present over here. Okay, the shading I have done, that is coronary ligament. So these are nothing but a part of the fibrous capsule that provide attachment to the peripheral margin of medial and lateral meniscus. Okay, so this is coronary ligament. So I'm again repeating what is coronary ligament. Nothing but these are the part of the fibrous capsule that provide attachment to the peripheral margin of the medial and lateral meniscus. Okay, wow. I guess you can see here, and this diagram is going to be about the synovial membrane. So this this one is synovial membrane. As you look deep to it, you know that it does not covers the articular surface of articular surface. Okay, ma. It lines the inner side of quadriceps femoris, and this is a tendon of quadriceps femoris. It just lines the inner side of the quadriceps femoris and some part of femur and some part of tibia. It does not lines the articular surface. Okay, va. So first point, it does not line the articular surface. It just covers the inner surface of the quadriceps femoris and some part of femur and some part of tibia. Okay, va. Just above the patella. So this is patella, and just above the patella, it forms suprapatellar bursa. Just above the patella, this one is known as suprapatellar bursa. Okay, va. So below the patella, the quadriceps femoris muscle tendon, it's separated from the synovial membrane by the infrapatellar pad of fat. That's all. So first, what did I said? It lines all the structure within the joint capsule except the articular surface. It lines the inner surface of the quadriceps femoris, some part of tibia and some part of femur. First point. Second point is below the patella, below the quadriceps femoris muscle is separated from the synovial membrane by the infrapatellar pad of fat. Just 3 I said. I guess you understand. So now let us go with the bursas. For bursa, I have, as usual, I have made